Clancy. I'm a marriage and family therapist, and I am here today to discuss how microcurrent therapy can be helpful with mental health.
Right. And I'm Guy Odishoff from Bhakti Wellness Center, and we offer microcurrent therapy at the clinic. And Crystal and I are going to talk about how that can potentially be benefit for some of her clients and for other folks that maybe have some mental health concerns.
So my first question would be, just tell us a little bit more about how microcurrent therapy can help people with mental health disorders like depression, anxiety, trauma, perhaps even some attention issues. Are those
Sure.
things that could be helped by microcurrent therapy?
Absolutely, and we can start off with a little bit of statistics, and we can look at sleep concerns. It's about 62% effective for addressing sleep issues. Depression, 47%. Anxiety, 58%. And then just kind of around cognitive function, or just a general state of people will talk about just my mind isn't clear, my thinking doesn't feel as focused. I'm just, there isn't necessarily a specific complaint, but they just feel a little bit off mentally, right? And
which
so
can happen with any of those disorders.
exactly, it can happen those, and then it can arise just kind of as its own apparent. And so for those just kind of more generalized kind of cognitive function, it's about 44% efficacy is what's seen. And so these numbers are actually really high for for something that's considered alternative medicine. But even if you don't look at alternative, if you look at other forms of conventional treatment for these conditions, it's rare to see efficacy rates this high across the board. And so that speaks to, again, it is effective. So that the research is pretty clear on. Where it gets fuzzier is the why is it effective, and part of that is, so one, microcurrent therapy is an umbrella to a lot of different modalities, and a number of different ways in which microcurrent is delivered to the body. And so today we're talking about a very specific kind of microcurrent under the umbrella, which is called frequency-specific microcurrent therapy. And even more, narrow niche within frequency-specific is tissue-responsive frequency-specific microcurrent therapy. And what that means is, like, a lot of people are familiar with what's called TENS. You maybe go to a chiropractor, they put a couple of pads on you, they run current through, the muscle contracts. More common now for athletes and maybe more kind of high-performance athletes is this machine called an ART machine, which is like a TENS machine on steroids. And it's become a very popular form of treating injuries, but also treating between workouts to recover faster so that they can get a better workout in the next time around. So there's that kind, which is definitely not what we do at the clinic. It's the opposite end of the spectrum. Those machines deliver, relative to our equipment, a high amount of current. They actually challenge the body and make the body respond almost defensively, but they use that response therapeutically, which is great, brilliant. It's wonderful, and it does its thing. So it is very much, again, the opposite end of what we do in the clinic with two pieces of equipment, the AccuScope and the MyoPulse. And the difference is kind of the difference between a dumb phone and a smartphone. Things like TENS is a dumb phone. It just does what it does. That's it. It makes and receives phone calls. If it's a TENS, it sends a current. That's all it can do. Versus a smartphone that can do all of these other things besides just make a phone call. So with our equipment, with the AccuScope, MyoPulse, they have biofeedback aspect where it's reading the system that it's treating,
Mm-hmm.
and then formulating a treatment, sending that treatment, reading the body's response to that treatment, recalibrating a treatment, sending that treatment. So as the treatment goes on, it's building a matrix of responses from that treatment for that person on that day. So it's getting a more and more accurate treatment for them and how they're responding today. And
Okay.
that's very unique in the world of microcurrent therapy. Otherwise, you've got a practitioner who's doing a protocol. They're just setting a series of knobs for a particular frequency and intensity, and they're delivering that treatment. And it still, even that form is quite effective, but it can't be regulated based on specifically that person's system. It's a protocol that is derived from research that is, again, a kind of a one-size-fits-all.
Okay.
So one of the reasons why we see better results with the biofeedback-driven equipment is because the treatment is for that person. Right? So, so what we're using is a millionth of an amp of current. For the most part, you don't even feel it. Sometimes people feel a little bit of a sensation of electrical current, but definitely rarely is it painful or even uncomfortable. It's just a sensation of current.
Yeah.
If at
I
all.
remember when you had me come in and
Yeah.
use it, I believe I fell asleep.
Yes,
So
exactly.
is that pretty common?
It is,
Okay.
absolutely. It's one
Okay.
of the most common responses. And I have clients that are, kind of A-type, and they're like, oh my goodness, I'm just going to have to lay here for 30 minutes and do nothing. Can I have my phone so I can do some
Right.
emails, right?
Yep, and that's me usually. That normally would have been me, and I know I dozed off because
Exactly. And
it
that's what I
went by really fast.
Yep. I come back in the room from this person who is just concerned about spending 30 minutes doing nothing, and they will commonly report, like, has it been 30 minutes already? I think I nodded off.
Yeah.
And that's the effect of the microcurrent, in this case the AccuScope, doing a specific treatment for the brain and central nervous system. It's kind of our base treatment that we use as a pre-treatment to any other treatment that we would do. And what it's doing is just normalizing the balance between the sympathetic nervous system, which is the arousal system, and the parasympathetic, which is the relaxation, regeneration, renewal side of our nervous system.
Okay.
It balances those two, and then has a bias towards the parasympathetic. So it puts people into the relaxation response, into
Right.
that restorative space.
Yeah.
On a very basic level, to describe it that way. And then,
So, oh, go
yeah,
ahead. Sorry.
well, then we can get more specific with it in terms of what is a person's diagnosis,
Right.
what's their concern, their presenting symptoms, and then we can, again, because it's frequency specific, we can narrow the parameters that the machine is working in to affect a system more specifically.
Right.
And so that might be, say, affecting serotonin levels. So a neurotransmitter that is affected through medications for some of the Prozac.
Yep. Antidepressants and anti-anxiety. Yep.
Anxieties that's one of the neurotransmitters they may be trying to stabilize or balance in the system. And we see with microcurrent, with a specific treatment, we can have the same effect. And again, some of the results are rather amazing, where with medication, we might see a person's system move towards normal in 3 to 4 days, looking at blood levels. But with the microcurrent, we can see that same change happen in 5 to 7 hours.
Wow.
We have a much more immediate effect on being able to change the biophysiology of a person's system in a favorable way.
Okay.
And then again, we get into the how does that happen, and it gets complicated in that we have to get into the neuroscience and the neurophysiology, but that science is there and available. But even for the people who study it every day, there's still this question of why does 10 hertz at make a particular neurotransmitter uh, be produced in the system.
Right.
Like that's the missing link. It's like why does the body respond that way?
Yeah.
We don't know.
Right. And it's hard to sometimes it's hard to not know that, but sometimes it's I think it is really helpful just to know that there is science behind it. I think that's where people get skeptical
Right.
about certain treatments. I was thinking about too that I work with perinatal mental health, so typically women who are pregnant or postpartum struggling with not just depression or anxiety, but also may have had a traumatic birth situation. And so, what you were talking about with the sympathetic nervous system, how people with PTSD, their sympathetic nervous system is always activated. And so, I could see why microcurrent might be a really good therapy, not just physiologically, but also because it is relaxing and it's really difficult, as I know you know, because you work with people with trauma, for people with PTSD to relax and feel safe.
Yes. Yes. So the getting them into a relaxation response, getting their sympathetic system to downregulate, that's what, in some ways, that's what we're all trying to do for them.
Right.
The different forms of intervention, and it's challenging. Uh,
Hmm.
and microcurrent is, again, it's another approach. Is it the be all and end all? No, but it's another tool that we get to put on the table to say, if some of these other things haven't worked, here's one that's safe and effective. I mean, one of the nice things about microcurrent, in all of the years it's been studied for decades, about almost 50 years now. Um, there's been no known side effect.
Wow.
No shown, provable, statistically significant side effect in any of the research that's done. And more importantly, those things that have been called side effects are what originally produced the treatments.
Okay.
That people's depression got better was listed as a side effect. People's pain went away. Was listed as a side effect originally in the research, and
Hmm.
now, of course, those are considered treatments.
Okay.
So it's nice to have a treatment where you might be treated for your back pain and your anxiety also diminishes.
Right. It's just like off-label medication use as well.
Well,
So,
yeah,
for sake of time, I think people are also going to want to just know in that typically these types of therapies are not covered by insurance,
correct.
correct? So, how can people, how would you maybe get them to let them know that this is an affordable option, that this is something that's worth investing in? What would you say to people
Yeah,
in that situation?
sure. If they are interested, they can certainly contact you through your website, me through my website. So they can go to bhakticlinic.com. Um, and from there, they can read about microcurrent, they can book an appointment, they can see the pricing, but they can also contact me to talk to me about is it appropriate for them, and what would a treatment protocol look like, and what would the cost of that be? Because it is not an inexpensive therapy. Uh,
Hmm.
we're looking at right now probably something in the neighborhood of $160 an hour.
Okay.
There are ways that can come down, but if we're just talking fee for service, um, cash out of pocket, that's the baseline one can expect, and not just in our clinic, but that's kind of across the market. That's the going rate for microcurrent therapy, and the main reason for that is the cost of the equipment. It's very expensive, highly technical equipment, and that's what drives the cost of it, and that it's not covered by insurance. So
Right.
the patient is having to bear a good amount of that cost.
Mhm.
So, so it can seem expensive, but when considered against the alternatives, actually, it's really not. And I would say the people who choose to do that in our clinic are people that have seen that value equation.
Okay.
To be able to have a treatment that's effective but doesn't require them to go on a medication, that
Hmm.
that like the cost of being on a medication long term is considered more of a cost than the money that they might pay for their course of treatment.
Okay. Yeah, well, and as we've talked about side effects, and I'm not anti-medication by any means. However, there are some people who, because of side effects, they end up being on a cocktail of medications
Correct.
to address those side effects, and so, or have to try several different ones until they find the right fit, which that is very costly and frustrating for people as well. And so, it definitely is just good to be aware of not just looking at it in a black and white way. And people can sometimes use their HSA to defray the cost, can't they?
Correct. They can
Okay.
use their HSA, and although we have said that it isn't covered by insurance, and I do like to say it that way to just make it simple for people.
Hmm.
But sure enough, we do have clients where it is being covered through their insurance.
Hmm.
But that's the exception and not the rule, and it
Yeah.
has to very much get into the detail of their particular policy and what's being
Right.
treated and all
Yep.
of that. So on occasion, it is covered. There's HSA and flex spending accounts, and then we have internally some other ways that people can lower that cost of care to make it more accessible.
Great. So, well, thank you so much. I wish we had a little more time to talk more because we easily could talk about this topic some more. But again, I just want to thank you also for letting me try it because it was very, well, it was very relaxing, but also just it helps me be able to let people know about it as an option to have experienced it myself. So, yeah.
And thank you for the invitation to talk today. Happy to do it.
Yeah.
And I look forward to our next installment.
All right.
Thank you.
Bye.
Bye-bye.